Hi, everyone. I'm Dr. Seth Meyers, and today in this video, I'm going to talk about an issue that I know affects many different people, and that is ADHD, Attention Deficit Hyperactivity Disorder. But specifically, I'm going to talk today about the impact of ADHD on relationships. This is something that often goes untalked about, and I think that it's really important for us to review a few points in this video so that everyone can kind of understand how this disorder actually impacts not just the person who suffers from ADHD, but also those who are in relationship with that person. All right, so to begin, I just want to share that there are a few different types of attention deficit hyperactivity disorder, and we will call that ADHD for short. There is a type that is mostly inattentive type, which means that it's mostly focused on difficulties focusing and concentrating. There's another type that is focused mostly on hyperactivity. So, hyperactivity is the main problem. There is a combined type that includes a mix of both of those. So, one of the things that I want to do is focus not on one specific type, but focus on ADHD symptoms in general and how those can impact a relationship. I do want to just take a moment and talk, though, first about how one gets properly diagnosed with ADHD. The best clinical practice for diagnosing ADHD is not just a clinical interview and completing rating scales with someone who is a licensed professional and able to diagnose, but also, in addition, a neuropsychological test like a continuous performance test. Now, when you hear the term neuropsychological test, that may sound very complicated. You may picture having to sit in a room and take 6 hours of complex testing, but that's not the case. There are actually some very quick, effective continuous performance tests, some that take about 20 minutes to take. And so these can be used in addition with the clinical interview that a professional does with someone to really make sure that they have data, multiple sources of data to give the right diagnosis. ADHD is something in my clinical experience that gets misdiagnosed a lot. So, one of the main things that I want to see when someone tells me that they have ADHD, one of the main things I want to know is, have they been tested? Have they actually had any neuropsych testing to show that diagnosis? Another point that I want to make sure we cover is that there is a spectrum of severity of ADHD symptoms. So when we are talking about being hyperactive or we're talking about difficulties concentrating, many people will have some of those symptoms, but not, of course, meet the criteria for a full blown diagnosis of ADHD. So we all, on some levels, can relate to difficulties concentrating at times. Maybe there are particular times of the day we have a harder time focusing. Maybe there are particular things going on in our environment, noises, things like that, that we can't have and also concentrate at the same time. Everyone can relate to some degree of hyperactive symptoms and to some degree of difficulty concentrating. But when we are talking about ADHD, we are talking about what is called functional impairment, an impact on a person's daily life. It affects their work life or their school life or their interpersonal relationships. It has a negative impact and it causes problems in their daily life. That is when you know that this can reach the level of something that is actually an official diagnosis. Next, I just want to review a few of the symptoms that a person with ADHD can have. And many of you will probably relate to this if it's you that has these symptoms or if it's someone in your personal life or maybe even your professional life that has these symptoms and it's impacting you. So I'm going to just go through a few of the symptoms. First, has difficulty paying attention to details and makes what seem like careless mistakes. So, difficulty focusing on and paying close attention to details. Has difficulty sustaining attention when they're doing activities. Often doesn't seem to listen when someone is talking to them. Has difficulty following instructions or following through and finishing tasks. These could be chores at home, completing lists, all sorts of activities. Difficulty finishing things and completing them. Often has difficulty organizing tasks and activities. It's just organization in general is like pulling teeth for them. Someone with ADHD may have difficulty remembering things. You may feel like there is just constant forgetting going on. The littlest things are not able to be remembered, just constant forgetting. The person with ADHD may also just seem very restless all the time. They may have great difficulty sitting still, sitting through things, sitting through a movie, sitting through a play, sitting even through a 30-minute meal, just focusing, sitting down and focusing and talking with someone in that contained environment, seated in a chair. Even that can be difficult for someone with ADHD. They may also have difficulty engaging in quiet activities. Picture, for example, a long table at a library. The library is quiet. Everyone is working on their individual tasks and being quiet. If you think about it from a stimulation perspective, there's very little stimulation in the environment. It is quiet. These sorts of quiet activities can be really difficult for someone with ADHD. Someone with ADHD, one way to think about it is, may have a lot of stimulation in their mind. If you were to kind of open up their mind and look in it, it is very active a lot of times. There is a lot going on in there. And so when that individual gets in an environment when there is no stimulation, when it is quiet, when there is not a lot of sensory stimulation in the environment, it can make them feel really anxious, almost as if they're being held up against the wall, almost as if they are trapped. There's one point that I want to make about ADHD that I think is especially important. ADHD, I think, is often a misunderstood disorder. So, a lot of times people will hear about someone who has ADHD, especially if that individual is an adult, and they will say, I don't believe it. I don't believe it. I think they use that as an excuse. But here's what I would say about ADHD. If you are someone who has been diagnosed by a mental health professional and you have had neuropsychological testing that supports that diagnosis, ADHD is a very real disorder and it has very real effects. It is not easy to be someone who has severe ADHD. It is always something that they need to try to manage and deal with because life and daily demands really require that people be able to sit still, be able to focus, do some of the things that are most difficult for someone who has ADHD. So I just do want to say that it is real. I also want to say for anyone who doesn't have ADHD, they may not be able to truly understand it. Here's one thing that I sometimes share to help people kind of understand things that I think are really difficult to understand. I know some people in my personal and professional life, for example, who have lost a child. They have lost a child prematurely. I think that that is probably one of those experiences that only if you have had that experience yourself can you probably truly understand exactly what it feels like. That, I imagine, is how painful, how confusing, how unnatural the experience is to lose a child. I think it's important for people to be able to try to empathize with someone who's had an experience like that, but to also remember that they probably can't understand exactly what that feels like. It is that unique of an emotional experience to that person. Well, ADHD, of course, is different. We're talking about something very different, but at the same time, the experience of what it feels like to have ADHD, that is something, if that's not something that you have struggled with, if you haven't struggled with that degree of hyperactivity or that degree of difficulty concentrating and focusing, I don't know that you will ever be able to truly understand how difficult it is, what a struggle it can be actually for that individual who has ADHD. So, I want to share from a couple of different perspectives on relationships, how ADHD impacts relationships. Someone who has ADHD may do things that seem really frustrating to others. They may do things like just get up in the middle of meals and walk out. They may be sitting with you, but not really seem to be listening. They may constantly interrupt you. They may go somewhere and then want to leave a few minutes later. The people around them understandably feel frustrated. They feel like, I want to do the simplest thing, and even the simplest thing becomes difficult because of their ADHD. People around that person can almost talk about the person with ADHD in a patronizing way, in a dismissive way, like it's not a real thing, like this is all in their head. We do need to understand that this can be a really frustrating diagnosis for the people around the people that have that diagnosis. If you are someone who is close to someone, who works with someone, who is in a romantic relationship with someone who has ADHD, in a close friendship, you do need to understand that there are certain impairments that this individual has. There are certain expectations that you need to be really careful about having. You can't expect that they are going to be able to do some of the exact same things that you do without ADHD and not have any problem with it. You have to have realistic expectations. You have to know the specific behaviors that they do that trigger your frustration. And then you have to ask yourself what you can do if you want to try to prevent feeling frustrated. Do you not go to certain types of activities with them? Do you go to half of a length of time of that activity and then leave, as opposed to trying to be with them the whole time? Do you let them know in advance, you don't have to stay for the whole time, I won't be upset? You really need to navigate, constantly compromise if you're in a relationship with someone who struggles with ADHD, either focusing or just being so hyperactive that just sitting still is a major challenge. The next thing you need to do is not an easy one, and that's to not take it personally. When you are sitting across from that person with ADHD at dinner and you're talking about something that's important to you, they may seem like they're not listening. They may make gestures or even just keep looking around and looking over their shoulder. And not only do you feel like they don't care, they're not interested, but you feel like they're actually being disrespectful. It's almost like they are just rubbing in your face the fact that they're not interested, that you're boring them, that you're talking about the same old stuff again. Well, you need to remember that this is not you. This is the diagnosis. It is okay, however, for you to say, hey, can you do me a favor? Tell me, are you having a little bit of a hard time kind of concentrating now? Or, what's going on for you now? Notice the way that I said that, it's not in a negative way. It's not in a positive or a negative way. It's completely neutral. It's just, hey, kind of let me know what's going on for you. I seem breezy. I seem light when I'm asking about it. That way, the other person can feel open to be more honest, right? This is not a loaded moment. I'm not about to get angry. I'm not about to get sad or depressed or disappointed because I had hoped that we could have this nice dinner. Nope, it's not emotional. I'm just saying, hey, kind of let me know, are you having a little bit of a hard time concentrating now? The more you do that from a neutral standpoint, the more honest the person with ADHD can be with you. So those are some really common things that happen if you're in a relationship with someone who has ADHD and what it feels like. So it's really important. Do not take it personally. Understand that this is someone who simply has some challenges. If you had your choice, would you wish that they didn't have these challenges? Absolutely. But we all have our own issues. And, really accepting someone, really caring about someone, and really loving someone is about saying, as long as this isn't hurting me, this isn't abusing me in any way, maybe I can try to look past this. Now, if these behaviors are things that have caused a pattern of frustration for you for so long, they're causing fights and arguments in the relationship with that person, you need to honestly ask yourself if this is a relationship that you can have. Being patient, being understanding in this way, and dealing with some of these behaviors in another person, maybe it's not for everyone. The question is it for you? If it's not for you, you need to really pause, make sure that's the right decision. Talk to the person who has ADHD, talk to them about it, and see what the two of you can figure out together. Now, I also want to take a moment and just talk about the experience of the person with ADHD when they are the one with ADHD and they have relationships with people who are constantly feeling frustrated by them, constantly telling them that they need to do this or do that, or they're not doing this enough, constantly finding fault with them. Now, even though it's legitimate, a lot of the frustrations may be legitimate still. Imagine what it must feel like to be the person with ADHD who is constantly hearing that. Deep down, we all, I believe, want to make people happy. We all want smooth relationships. We all want to feel liked. We all want to feel certainly understood. Well, think about it. If you're someone and everyone around you is constantly complaining to you and criticizing you for the simple things that you just don't seem to be able to do, we have to all imagine how that must make that person feel. It can make the person feel really small. It can make the person feel really frustrated in their own way. It can make the person feel like deep down people don't really accept who they are. Now, people who suffer from severe ADHD, they don't want to suffer from it. If they could push a button, flip a switch, they would. This is a disorder. It does negatively impact people's lives. It makes people's lives more difficult. It doesn't mean that it's not something that someone can learn to manage better. You can, and I'll talk for a moment about that at the end of the video. But I do just need to make sure that we all sort of take a moment and think about what it feels like to be the person with ADHD. They have their own frustration. They feel like they come up short. They feel like sometimes they say, I feel like I'm not good enough. I feel like something's wrong with me. These are all natural feelings that they have. Now, they are good enough. There is nothing wrong with them, right? It's not like the factory made a bad model. No, we all have human brains and human bodies, and they're not perfect. And sometimes we don't even understand why our brains function in the exact ways they do. This is what it is. But I do think that we will all serve ourselves and our relationships better to have respect and to have some compassion for the person who does have ADHD, who suffers in that way. It is not easy. And if you are the one that suffers from ADHD, my heart goes out to you. What I want for you more than anything is to make sure that you are doing everything you can to manage it well. Now, I'm just going to close today by saying, how do we manage ADHD most effectively? Research shows that talk therapy can be very helpful if it's evidence based. There are very effective forms of cognitive behavior therapy that can be helpful in treating ADHD. And there is also medication treatment that can be effective to treat ADHD according to research. Now, for you to make those decisions yourself, those are very personal decisions. I don't advise anyone to take medication. I advise people to talk to their doctor about whether that's something that could help them. These are big decisions to think about, but there are things that you can do. And in fact, one of the easiest, the simplest things you can do, and doesn't even require that you call a doctor, is for you to go online and search for a good ADHD management workbook. You can find a $15, $20 workbook, and you can find exercises in that workbook that can help you deal with some of the ADHD symptoms. But overall, the main point is this: if you have a disorder and you work really hard to manage it, to try a multi-pronged approach to treat that disorder effectively, you will usually end up having improved symptoms. So if this video has been helpful, please like this video. You can also check out my weekly podcast, Insight with Dr. Seth, where I talk every week about different mental health topics. And I wish you all the best as you deal with this situation.